Hi.
How are you doing?
I am fine. I am good.
So,
Uh,
can you tell me about yourself?
See, I am Dr. Salim Lad. I am the professor, head of the department of DY Patil Medical College. I am the head of the department since the year 2011. So I am heading this department for almost last 13 years. My association with Dr. Shekhar Bojraj goes way back in 1994-95 when I was working with Sir in PD Hinduja National Hospital as his clinical associate. So he was a person who initiated me into the spine surgery. And how did this journey start? It started by an accident where we sir sent a copy of his books, Rural Spine Outreach Program. So this idea struck me that we should start this kind of a unique program in our hospital.
Okay, so what is your role as an HOD over here?
So my role as an HOD is very multi-pronged. One is this Kolhapur district, though has a lot of rural pockets in it, which are not very accessible, and most of the people engage in farming over here. And lot of patients have got spine problem, but quality spine care for them is not very easily available. With the help of Spine Foundation, what we have been able to do is channelize all these patients and bring them over here and give them valuable guidance. So this guidance, I always keep on telling, is not in the terms of surgery always, but what exactly he needs to do. So his proper diagnosis and what is the most judicious treatment for him is told to the patient.
Right. Good evening, Dr. Salim.
Hi.
Uh, so, can you tell me what is your role as an HOD over here?
See, this is a very interesting question which you have asked and a very pertinent one. I have been the head of the department since the year 2011. So, for almost around 13 or 14 years. But my association with Sir has been a very long one, where I was Sir's student in Hinduja Hospital as a clinical associate in the year 1995 and 96. And that initiated my interest in spine surgery. And as a head of the department over here, I always felt Sir should be associated with our medical college. And how did it all start? It was a very interesting thing how it started. One day I received a book which is known as Rural Spine Outreach Program, the book which is written by Sir. And after reading that book, I came to know that Sir arranges all these rural camps and where the underprivileged and poor patient get quality care. And I felt that why not us? But initially I was very much scared because our being a private university, I was not sure how comfortable Sir would be. But once I assured him that we are going to cater to only the poor and underprivileged patients, and we have been doing this for the last now almost 4 or 5 years very consistently. Now we are doing more and more difficult kind of cases. So it has been a very wonderful journey for us. And most important than that, what it has done is not only it has imparted education, care to the patient, but it has helped our students because every month one of our student goes by rotation to Mumbai to VN Desai Hospital, so he gets sensitized to all these kind of work. So this social work, whatever we are doing, all these students are lucky to get this imparted very early on.
So, how do you ensure that the partnership with the Spine Foundation aligns with the overall strategic goals of the DY Patil Hospital?
This is an interesting question. Again, I am telling you कि our being a private university, Sir Bhojraj sir was initially skeptical कि how this is going to work out. But once we told him that we are getting good number of poor and needy patients, and we can provide quality service to them. The reason being because we have a wonderful infrastructure over here, and more important than that, good human resource. in the form of students who are very interested to learn spine surgery. So automatically it has become a very wonderful journey, not only in terms of giving quality spine care to the poor patient, but also as a form of learning for the students. So this has been a very important facet.
Done. So, as the HOD of the hospital, can you provide us with an overview of the collaboration between the hospital and the Spine Foundation and its significance in patient care?
The most important thing what has happened is that because of the collaboration with Spine Foundation and especially post COVID, what we were able to do is start with the online spine OPD. That has been a real game changer because these patients from Kolhapur district going to Bombay and seeking an opinion is very difficult. So doing this online spine OPD in a real time way where the patient gets a proper opinion is one of the best things. And this was really the most important thing that happened post COVID. So and all cases we discussed in on the online spine OPD, so we are able to plan them better and provide the patient with quality spine care. So and also it is a two-way communication where the patient can also talk to the consultant over there. So it has been a wonderful method of giving an opinion to the patient and treating them judiciously.
How has the
Resources brought in
expertise
by
and the
the
Spine Foundation enhanced the existing capabilities of the DY Patil Hospital?
See, before the collaboration, we were doing spine surgery, but deformity corrections, minimally invasive surgeries used to hardly do. So, with the collaboration with the Spine Foundation, now we are able to do complex spine surgeries, difficult spine surgeries, which routinely are not done in our area, especially deformity corrections, scoliotic corrections. So these patients have got a significant deformity and disability, and if they are not corrected early on, lifelong they have a disability. So it has been really a game changer in the form of deformity correction surgery. We have been able to.
So, how has the collaboration impacted the reputation of DY Patil Hospital?
See, it has impacted significantly. The reputation of the Spine Foundation has significantly rubbed on our DY Patil Institute in the sense that we are getting a lot of referrals from the orthopedic surgeons here because now people are aware that we are doing all complex, difficult cases over here, and especially poor patients, poor underprivileged patients who hardly had any option but to go to Mumbai, and traveling and going to Mumbai is very difficult for a lot of people. So we have been able to cater to those kind of patients, and our referral from the local orthopedic community and ASHA workers and all the social workers has increased significantly. Just to give a simple example, because of the outstanding work we have performed and the collaboration which we have had, we could get the donation of the Sunrise Rotary Club of almost rupees 40 lakhs, and they provided us with three quality spine set, a good light, a Midas Rex drill, which can be used for practically all spine surgery. So it has helped us immensely.
So, what are your end thoughts about the collaboration between the Spine Foundation and DY Patil Hospital?
At the outset, the first thing I would like to say is a big thank you to the Spine Foundation and the amount of quality care it has brought to our patients. And I feel that this association which we have built so painstakingly on either side, we continue this for a very long time so that we are able to provide this care to the poor patients. It was wonderful talking to you. Thank you very
Likewise.
much.
Yeah. Thank you.
Thank